We're going to talk about the fetal circulation and also about the changes to the fetal circulation once birth has occurred. Before we start all this, I just want to remind you of the adult heart and the circulation through the adult heart. And we've got a diagram here that I'm just going to draw on it and remind you of the blood supply through the adult heart. So here we have the vena cava. This is your inferior vena cava, and above we have the superior vena cava. So deoxygenated blood from the vena cava, superior and inferior, will enter the right atrium. It will then subsequently go through the tricuspid valve into the right ventricle, along the pulmonary tree, backflow being prevented by this semilunar valve here, along the pulmonary tree, along the pulmonary arteries to each of the lungs, where gaseous exchange will occur and oxygenated blood will return to the left side of the heart from the lungs via the 4 pulmonary veins. So the oxygenated blood now will enter the left atrium and go through the bicuspid valve into the left ventricle. Blood then will be pumped from the left ventricle through to the aortic systematic arch, backflow again be prevented by this semilunar valve here. Highly oxygenated blood that has been pumped into the aortic systematic arch will then go up to the head and neck via the carotid artery, the coronary arteries, and to the upper body and neck by the subclavian artery. The rest of the blood then will go down the aorta, down the descending aorta to the rest of the body.